Okay, let's just dive right into it. We are going to tackle one of the most common and, let's be honest, one of the most searched questions men have. But we're going to do it by cutting through all the noise, all the hype, and just focusing on what the science really has to say. So this is probably the question that brought you here, right? It might be phrased a bunch of different ways: how to get longer, how to increase girth. But it all comes down to this one core question, and you're looking for a real, straight answer. And that's exactly our mission here. This isn't about myths or magic pills or trying to sell you something. This is about giving you the honest, evidence-based facts so you can actually understand what's normal, what's possible, and this is the most important part, what's truly dangerous. To really get to the truth, we first have to talk about a huge, huge misconception. Because for most men, this whole issue doesn't start with a physical problem. It actually starts with a psychological one. This is where it gets really interesting. Check out the massive gap between how guys feel and what their partners think. Study after study shows that while more than half of men are unhappy with their size, the vast, vast majority of their partners, they are completely satisfied. So what is going on here? What's causing this disconnect? Well, a huge factor is just unrealistic comparisons. The images men are constantly exposed to, especially in pornography, create this totally distorted idea of what's normal or average. And that, of course, leads to a ton of unnecessary anxiety. So let's just ground ourselves in reality for a second. What is normal? Well, when scientists gather data from thousands and thousands of men, the medically established average for an erect penis is about 5.2 inches or 13.2 centimeters. And you know, the normal range around that average is actually really wide. A penis is only considered medically unusual if it falls into a very specific category called micropenis. That's under 2.9 inches when erect. And look how rare that is. It affects less than half of 1% of men. So for pretty much everyone else, the concern isn't a medical one, it's a psychological one. And this brings us to the absolute heart of the matter. For the vast majority of guys worrying about this, the real problem isn't their size. It's the anxiety that surrounds it. And this is a real recognized condition. The key part of this definition is that the distress is often completely unrelated to a person's actual anatomy. It's about a persistent obsession, sometimes for hours a day, even when a person's size is perfectly normal. It's what's in your head, not what's in your pants. And make no mistake, this anxiety is not a small thing. It can have absolutely devastating consequences. It can interfere with your job, your life. It can lead to serious depression, cause men to avoid relationships and intimacy entirely. It creates very real mental health challenges that deserve to be taken seriously. Now, when that anxiety drives someone to go looking for solutions online, they can wander into some very, very dangerous territory. It's like the Wild West out there. A quick Google search will just unleash a flood of sketchy, unregulated clinics, people who aren't licensed to do what they're doing, and all these dangerous solutions like mystery injections and fillers. And it's all offered with zero real medical oversight, just preying on people's deepest insecurities. So what does the actual medical community say? The people who know what they're talking about? Well, they are crystal clear on this. Leading sexual medicine organizations all agree. These procedures are flat out not recommended. They're considered experimental and unproven. And the results of ignoring that professional advice, they can be absolutely catastrophic. We are talking about permanent disfigurement, infections that never go away, a complete loss of the ability to even get an erection, and horrible complications that can just destroy a person's quality of life. So, with all of those serious warnings in mind, what are the actual legitimate options? Let's take a look at them, based on the real evidence. Okay, this is probably the single most important point of this entire explainer. The most effective and the most recommended first step isn't a device, a pill, or a surgery. It's dealing with the anxiety that started this whole thing. And the research on this is pretty amazing. Men who get counseling to deal with the anxiety, who learn about what normal anatomy really is, and who work on building their confidence, well, they often decide they don't need any physical intervention at all. This is by far the safest and most successful treatment. Okay, but what about physical options? Well, these traction devices are really the only non-surgical method that has some consistent evidence. But let's be brutally honest about the reality here. The promise is more length, but the reality is a tiny gain, maybe 1 or 2 centimeters, and that's only if you commit to wearing it for hours a day, every day, for months and months on end. And it's not risk-free either. You can end up with bruising, numbness, and just general discomfort. And after all that time and effort, there's still a very real chance you'll see no results whatsoever. So what about the most extreme options, the injections and the surgery? Well, they promise this dramatic, life-changing increase, but the medical reality is just devastatingly different. We're talking minimal visible change, incredibly high rates of complications, and a huge risk of losing function completely. This is exactly why these procedures are so strongly discouraged. The risks are just off the charts. Severe complications, permanent tissue damage and deformity, infections. You can even have problems pop up decades later. You risk losing both stability and function forever. So let's bring this all home. The real takeaway here isn't about chasing a number on a ruler. It's about finding a sense of confidence that has nothing to do with measurement. I want you to really think about this quote. When you're considering these risky procedures, remember this. The worst thing that can happen isn't that you stay the same size. The absolute worst outcome is ending up permanently damaged, in constant pain, and with something that doesn't even work anymore. And that's really the final thought we want to leave you with. Your health, your confidence, your worth as a person and a partner, it has absolutely nothing to do with a tape measure. Protecting your physical health and your mental health, that has to be number one, always.